Hi, can you tell us what you do during your treatment sessions?
First thing is my treatment session usually lasts about half an hour to about 40 minutes max. And that is mainly for, I would say, helping a person with an injury, with a pre-existing condition. Yeah. So for injury prevention, that usually people will do a massage and stuff. That will usually be an hour to hour and a half. That's different. Okay, so now we are talking about helping a person with a pre-existing chronic or acute injury, or sometimes even a restriction. So what I usually do in the beginning is I would ask about I'll look at the injury history, and that requires an interview process because it's very important to know how the client got the injury, how long has he got it, and what was his previous injuries before the injury that he has gotten, as well as what are the steps that he has taken in order to resolve the injury. After that, I will do some testing, do a palpation method, testing, feeling, range of motion. Of course, using your hands to also feel the different muscles, the densities of the different muscles. Okay, but testing usually will take only about 5 minutes. Right? I don't believe in too much testing because too much testing actually eats into the client's time in terms of helping him fix the problem. Right? If you intend to, for those therapists out there who intend to do a little bit more testing, or use like NKT or other methods to do more testing, then you have to fit it into your time. You might have to extend your time, and definitely that will reflect in the charges. Right? But most important thing is that when the client comes to see you, he wants the problems fixed. So you have to take that into account. And then you have to manipulate your testing time and really work on how you can treat the client a little bit more effectively. Of course, after the testing time, I would then do the manipulations. Manipulations wise, there are many things that I use. I use needling, dry needling. Nowadays, I also incorporate a bit more of acupuncture in order to help improve the neural function, or what we call the brain to hand and feet connection.
A quick question, the difference between dry needling and acupuncture?
Acupuncture works on Chinese meridian points, and dry needling works on the trigger points, works on scarring, works on the thickening of fascia. So there are two different modalities, of course, using the same type of needle that the Chinese use. And I also do ART, active release techniques. Active release techniques works on the basis of getting a muscle to slide past one another, because if there is a mechanical failure between two muscles, that is when pain is created. So it's two different modalities which I use. And that's for injury prevention. That's for helping a person overcome chronic and acute pain. And I would also do sometimes facilitated stretching, helping a client to stretch out the muscle. And I also teach the necessary homework to lengthen and to activate the muscle which is not working there. Yeah, so that's what I do for helping a person overcome chronic and acute pain. And after the session, I'll also kind of assess and tell the client like, hey, you might need to come once a week for a few weeks, or even come for personal training sessions to help overcome the injury. So this is what usually happens. And I would always emphasize the need to do rehab and corrective work, to do strengthening exercises, because that is the most important part. Because my job is to help cut that vicious cycle of pain, of chronic pain. And once I cut that process, you need to do certain exercises in order to help prevent it from coming back. So my trainers and my staff have a very big role to play in that aspect.
Thank you.